Good morning, Dr. Lebo. So I just did my follow-ups. Now, today, the main course, the artiste of the day is this gentleman from Philadelphia he's 40, from Philadelphia, who already had gynecomastia surgery in Philly. I'm not going to tell you who, but I see a lot of this person's patients from Philly, and all they did was gland removal. He had gland removal done a little bit ago, but he's happy with the gland removal. Not saying anything bad about anybody, because that's what general, regular gynecomastia surgeons do. They don't really know the artistic nature of this operation and the artistic results that people, really want and expect. So he searched me out, and the glands are gone, as you can see. Really do not have to explore underneath there. You can see the incision, not that bad. But what bothers him is all this junk, all this. He says, yeah, the doc took out the glands, but, didn't really shape me. And it's really about definition, high definition, muscle movement, and athletic lights and shadows. So we're doing it all from neck to nuts. We're going to etch the pectoralis major muscle. He didn't want any lipofilling, but you know something? He's shaking his head, but I think we have to do it. We don't have to go crazy. You don't have to put 250 in him, but a little bit of pop, especially since he had this, to really accentuate and lift up the chest. Obviously, going to the lats, it's, again, all about the muscle definition. Put some shadows here and some light here, etch the lats. He wants down here. We're not going to do the lower back, but he's awake. It's local anesthesia, so we'll turn him on his side, and we're going to scoot all the way down here. Stealth incisions, armpit, nipples, belly button, and groin. Get the midline linea alba, the semilunaris down to the V to P. Get a little bit of that fupa. Get the serratus muscles. Again, it's about muscles. Get the six-pack abdomen, 2, 4, 6. Get the semilunaris, and really just scoop him down to accentuate his hip and his body, and just clean him up beautifully. And again, at the end, pectoral lipofilling. With me, it's all about muscle definition, dynamic etching, defining, contouring, and sculpting the male body to perfection. And that's all I got to say about that. Let's get going. All right, so the anatomy markings are just the roadmap to success, the roadmap to perfection. And this is my markings. Pectoral lipofilling. The hockey stick look to his pectoralis major muscle right there. The six-pack going on, the midline linea alba, the semilunaris down to the V to P. The fupa, getting all that fupa out. He busted my ass to get this. We're going to do it. Busted my ass to get this. We're going to do it. We're going to maintain volume where we want it, like the lats and like the pecs, and even the six-pack abdomen, and we're going to etch everything thoroughly. The 2, 4, and 6, the midline, the semilunaris, the serratus muscles. Get all the way, empty this, get that V to P, that great shape there. All of that going perfectly out. And again, pectoral lipofilling to give them an athletic Hercules chest done to perfection, and results are guaranteed. Let's hop to it. Good. We've got some scar tissue here, but I'm right where I want to be. And as they always say, we pump you up.
And we are here to pop you up.
All right, guys, so here we are. In the armpit. Lift up that armpit. Good. And we're getting this space between the lats back here We're on 70 Vaser. Perfect. So this is a 2-ring. I'm on 70 Vaser, and it's the 2-ring long, so I can really get down and hit everything through my stealth incisions. Really kind of work this nicely. This one. Wants me to get this, which is very important. So get into the armpit here, down to the lats. Last couple of seconds.
1 minute to 3.
Perfect. Yep. All right. So here I am again. No lipoing, no vasering up here. You can see he had in Philly surgery there by a plastic surgeon, and all he did was pretty much take out the glands without sculpting. And that's why I tell you, gotta go to somebody. You know, everybody says they do this, but you know, I do it artistically. So I want to maintain all volume there and the lats in the back, and hit this underarm really hard. Sculpt the lats, sculpt this negative space between the pecs and the lats, and then form these muscles amazingly. So keep volume up north. Get up there. 3 minutes here. And the beauty of this on the local is I got feedback from the patient. So if I'm going a little too deep, I hit his rib. He goes, I can feel it. I can feel him, you know. And I say, oh,
1 minute.
careful. That's why local anesthesia with this lipo is a lot safer. In my hands, my belief. And they generally have no patient feedback, and you can, you know, there's been some harm. With local, his ribs are not numb. And if I go a little too deep, a little too aggressive, he'll say, Doc, and I'll go, oh.
30 seconds.
Danger, Will Robinson. And you gotta be careful. He's got a kind of a wide chest. You gotta watch out for these bones and these ribs. You gotta be cognizant of where you are. You can't be just a cowboy. You can be a cowboy. But if you got a good cowboy. All right, so here I am at the lower box. And what we're doing now is lipoing. We wash them down, remark them, long cannula, and we're etching. Remember, he had gland removal in Philly a couple years ago. No real lipo, he doesn't think. He doesn't know because he was asleep, and the doctor didn't tell him. What's that?
That's right.
Yeah. You know, you need communication. The doctor should be very communicative. But with me, since it's on the local, everybody knows exactly what they're getting. So, it's an extra long cannula. They normally come in 40 centimeters. I've had this made I'm sorry, they normally come in 30 centimeters. I had this one made in 40, specially made for me. And it came straight. And I bent it so I can get around, you know, my anatomy here. So again, let me show you. It's 20 degrees, so I can scoop it this way, get around, and then scoop it this way so I can get in by this scoop. Be careful of the ribs, turn it, and go around to the belly. And I constantly know, see, I just did that. Constantly know where I am. Way up here. So now, way up high, he's got a little shoulder. He had labrum surgery on his shoulder. So he's got a little tight shoulder. One was more recent than the other, so I got to be respectful of his shoulder here. I don't dislocate it. I won't dislocate it. I won't dislocate it, I promise. But I don't want to hurt him. What's that?
It's all good.
Yeah. So now with my, look what I'm doing, guys. Rain, come over here. Look at, I'm getting way back here. And I haven't turned them on the side yet. We'll do that towards the end. But look what I'm doing with his lats here. Again, I want to maintain volume where I want it. Look at that shape. This is what I'm talking about. This is Lipo Gyno. So now, with my smart hand, I'm etching, grabbing the muscle. And I'm getting into this negative space. He's fixated. This guy's fixated on two things, mainly. The armpit and the sides of his belly to the back. That's he's fixated. And if he's fixated, so am I. Maintain that volume there. It's curved. I can curve it up, get superficial, 20 degrees, and look where I am. And from neck to nuts with the one cannula. And I could carve it down to get this beautiful semi-lunaris, I call it. And into the flanks. All the way back here now. And again, we're going to get him on the side. I want to etch between the pec muscle. Give him some nice, beautiful definition there. Side gives me my chop technique on the back. You alright?
Yeah.
This is what you wanted. This is what you busted my balls for. Hey, Winnie. Don't forget. Alright, just finishing up. Very last of the last. Looks amazing. Gyno, one of the finishing touches, there's a finishing touch in the end of this, but this is Renuvion powered by JPLASMA, helium gas with a radio frequency spark at the end. This technology has been around forever. This is the same as a cautery basically, and this is the gas and the radio frequency spark. Go in again with my stealth incisions, 1.5. And this really helps to tighten up the skin. Many years, very safe. It's a radio frequency. So it's radio frequency RF technology with a helium gas component, so it acts as a carrier. So it tightens up the skin. So it really, so after lipo and after gyno and after gland removal, the skin will not sag. That's what a lot of people worry about. It acts about 30% immediate, and then so 1.5 again here.
4.5%.
And that people worry about you know, skin laxity. You okay? We're almost done. Skin laxity after lipo, after gyno, especially if you're older, you know. Get right on in there. Remember, he had gyno surgery in the past with results that left a depression there. So I need to fill a little bit of that in. So he's got like a nice hockey stick look. Oh, Lipo Gyno, an amazing case, a fixing of, I wouldn't call it botched, but I would say it was an underwhelming gynecomastia surgery that this gentleman had. He's from Philly, he had it in Philly. How old are you again, 40? Mm-hmm. 40. From Philly, he had a couple years ago, gynecomastia surgery from a prominent doctor in Philadelphia, and it wasn't botched, it was just he was underwhelmed with the results. So he discovered me, and I did it right. We did Vaser, high definition power assisted liposculpture. The glands were removed. They were actually over resected in the past. We did the pecs, we did the lats, we did the negative space between the pecs and the lats. We did the semilunaris down to the V to P, the median linea alba, the same thing on the other side. Six pack 2, 4, and 6. The serratus muscles. We did the lower box, the V to P, all the way down to his sides, even to his back. We got 3.5 liters of fat on him, from him, and we processed some of that fat. We put 200 cc's of pectoral lipofilling into each pectoralis major muscle. Now make a muscle. There you go. This, no depression, no concavity, Spartan Hercules look. Suck in your belly, breathe a little bit, look at that V to P. He's still swollen. It was done under local anesthesia. We're finishing up right now. This is what I'm talking about. So if you have gynecomastia, either primary or you were underwhelmed with the results from some other plastic surgeon, you call me. We'll discuss everything. See how I can help you and what I can do for you, because I deliver the goods and the results are guaranteed. LipoGyno 631-424-0101 or email me at jonathanleibowitz@gmail.com. Thanks and see you soon.